The evolution of LASIK is really a very interesting story. I think a lot of eye care started in 1949 when that was the year contact lenses were invented. That was the year the first cataract implant was put in a patient's eye. And that was the first year that the pre-runner of LASIK was done. Going back to 1949, you had Dr. Jose Barraquer, who comes from a very famous family of eye surgeons in Spain. The whole field of LASIK came out of his head. The first case he did was manually making what we call it wasn't a flap then. He removed the surface of the cornea from a patient. And remember, contact lenses were invented that year. He already had, in another part of town, a cryo lathe. There was a lathe used to put the prescription in plastic for contact lenses, but it was also, you could freeze things with it. So he traveled across town with the patient's surface of their cornea, froze it on the cryo lathe, etched the prescription in it, and drove back and sutured it back on the patient's eye and cured their nearsightedness. That was the first case, 1949. It was all free-handed. Now, of course, we use lasers for everything. So, Barraquer worked on this tirelessly forever, through the 1950s, through the 1960s, inventing instruments to make it easier so we wouldn't have to freehand things. And then came along a brilliant student in the early 80s, Luis Ruiz, who the other students in the residency program resented because he was made the chief resident when he was a first-year resident, which never happens. It was bizarre. But Barraquer recognized something.